Welcome back. Now, Namibia will receive the first doses of the Pfizer BioNTech vaccine, which was acquired through the COVAX facility by the end of this month or early next month. The country targets to vaccinate 20% of its population. Naomi Shapala, who is the Director of Primary Healthcare Services, as well as Dr. Theo Ben Kandetu, who is the Case Management Pillar Lead, now joins us with more information on these vaccines, as well as the vaccination of the Namibian population. Good morning to you, and thanks so much for being here this morning.
Thank you.
Good morning, thank you.
Mr. Shapala, firstly, we are of course expecting these vaccines to arrive towards the end of this month or early February. How far are we in terms of preparations to receive these vaccines here?
Thank you. There's great progress in terms of the preparations. The country has established a national task force with several subgroups that are looking into specifics of preparation for the introduction of the vaccine. Yeah. Perhaps we also know that the cabinet has approved funding for 1 million plus doses of the vaccine at the tune of 193 million. This is to vaccinate approximately 20% of the population. Yeah. We also know that this task force has been working on the introduction plan, which has got specifics on the deployment of the vaccines, as well as a communication and community engagement strategy to ensure that the public is well educated about this vaccine. Indeed. We've been seeing on the news infodemics, misinformations. So these pillars of the National Task Force is really trying to educate the public and give them the correct information. We also know that this National Task Force has been working on detailing the target population that is targeted for this vaccine, including the frontline health workers, people with advanced age at 60 years and above, essential workers, including police officer, immigration, people on the front line, people with disability, people with comorbidity, and the list goes on. So really there is a great preparations, and we know that the Minister of Health and the Minister of Finance has been engaging with other stakeholders in the medical aid industry and corporate Namibia to try and get them on board in terms of securing resources for additional funding to vaccinate more people in the country.
Thank you so much for that elaborate explanation there. Dr. Kandetu, do we have an understanding of how much the target population is at this particular point in time, and are these first batch of doses sufficient to cater for this target population?
Yes, so we do, as Mrs. Shapala has indicated, there is a national COVID-19 vaccines task force that has been hard at work on working on a robust, not just communications strategy, but also a rollout strategy. And part of that rollout strategy, because we are not initially going to be receiving the amount of doses that we need to achieve herd immunity. So we need to ration it. So we need to give the initial doses to the at-risk population. Yes. So as Mrs. Shapala has already alluded to, we have identified who these at-risk population groups would be. Amongst them are healthcare workers, those with pre-existing comorbid conditions, and the list goes on. Unfortunately, what this list does not include are those who already have COVID-19 and who are hospitalized.
Okay, so those will not make it onto the list.
Those ones initially will not be a part of the rollout strategy. Reason being, the vaccine is a preventative measure. Okay. It's not a treatment, it is not a cure. But having said that also, they would also be allowed to get vaccinated once they have recovered. Okay. So they would have to wait until they are no longer ill and are deemed recovered to get vaccinated. Now, according to CDC, they would have to wait roughly 90 days from the initial infection to be eligible to get vaccinated.
Okay, fantastic. Just a quick question: how much of the population, or percentage of the population, would we have to vaccinate to what qualifies as herd immunity? Just for the sake of our viewers here.
Okay. So, according to literature, for us to achieve herd immunity, for any population, any country to achieve herd immunity, at least 60 to 70% of that country's population must have been vaccinated. Yeah. Now, as I'm sure you may be aware, via the COVAX facility that Namibia has entered into partnership with, we will only be getting 20%, or we'll only be getting enough vials to vaccinate 20% of the population. So there are also other initiatives that we are working on to meet the 60 to 70% vaccination target.
Fantastic. Coming back to you, Mr. Pala, of course, and coming back to those negative connotations around this vaccine, they are rife, especially on social media, etc. They are circulating in WhatsApp groups. Just to reiterate the message of the ministry, the stance of the ministry, and of course the importance of people getting this vaccine. Yeah.
Thank you. So what we have to acknowledge is that it's a new disease, it's a new vaccine. Yeah. And whenever there is a new medical intervention, sometimes it's received with mixed feelings and hesitancy. This is due to the limited knowledge, yes, and the fear of the unknown. But we are very optimistic that as we begin with these communication strategies and community engagement, we have been following what is happening in other countries, and with access to the media, the community is also seeing how the world is moving forward in terms of accessing the vaccine. Yeah. I really believe that seeing is believing, and the actions and the results that we'll be seeing from this vaccine will speak louder than words. It's really to let the public access the correct information, yes, to share the correct information, to refrain from circulating unconfirmed material that are kind of just raising fears among the community. But it's really all our role, either from the health sector or from other sector, to join hand and provide correct information, so that people have correct information, because that knowledge will empower them to make the right decision in terms of the vaccine. Very
much so. Doctor, maybe you can just add on to what Mr. Pala has added. Of course, we know the fears, we know the doubts that people have around this vaccine, saying that it's rushed. Was the proper work even done? Was the proper work even put into it? What reassurance is there from your side here?
So I think it's very important to note that the vaccines that are currently on the market, that have been pre-approved by the WHO, are ones that have really undergone stringent processes in terms of determining whether or not they are safe, yeah, and effective. So maybe if I can expand a little bit on some of those processes. For example, at the clinical trial level, every single vaccine that has been manufactured must have undergone clinical trials, and in a clinical trial there are also a number of processes and phases that need to be met. Yes. Once the investigators of a clinical trial deem that their vaccine that has been manufactured is now an effective and safe one, there's now a series of reviews by independent panel of experts that need to be made. This has to be done to ascertain really that the allegations that the investigators are saying about the vaccine, that it is safe and effective, is it true? Yes. So this must be done for the trial to be published in an accredited medical journal. Once that happens, there's another set of review mechanisms that need to take place, yeah, in the country where the vaccine was manufactured. They also need to satisfy their own regulatory regulatory processes to make sure that the vaccine is safe and effective. And of course, this all happens before the WHO then comes on board and pre-qualifies the vaccine.
Very much.
Now then, specifically in Namibia, we also have our own regulatory mechanisms. And it's being done by the Namibia Medicines Regulatory Council. They also need to satisfy their own review processes to make sure that, in fact, the vaccine that ultimately ends up in Namibia is a safe and effective one. So really, there are a number of processes that take place from the time the vaccine is manufactured right up to the time that the WHO pre-qualifies it for distribution to the world, right up to the time that the vaccine enters into the country.
Doctor, just briefly, we know that this coronavirus is mutating, it's evolving. Of course, we hear new variants, etc. The question now is how safe or how secure is this vaccine against this mutating virus, so to say, and furthermore, what do we know as a country, Namibia, about these new variants?
Yeah, so that's a very good question, and it's a topical one at the moment. What the WHO has said is that the current vaccines that are out there, they have been proven to host a broad immune response, which is believed to cover the variants that are out there. But of course, the variants that are out there are new. We still need some time to review and study them, and that's what is being done right now. What we do know, and which is not a whole lot at the moment, what we do know about the new variant is that there's one that has been discovered in the UK. There's one that has been discovered in South Africa.
Yes.
We do know that these variants seem to cause a more robust
infection rate,
transmission. So they are more infectious.
Yes.
But there's no evidence out there right now that seems to suggest that the variants are more virulent. So what that means is more lethal.
Okay.
Which is, at this point, I think, reassuring. I think what people also need to understand is that the same public health measures that have been there to guide and to mitigate the spread of the virus applies, whether it's with this variant or with that variant. The same public health measures must apply. And that is the correct use of, or the correct wearing of the face masks, it's hand hygiene, it's the physical distancing, and so forth.
Very much so. Thank you so much for that, Doctor. As we round up this discussion with Ms. Shapala, just looking at the current rate of infection, it is highest amongst people aged between 20 to 49, and of much of it is attributed to social behavior. Just what do you have to say to the Namibian public this morning?
So we are really encouraging and asking that the young people that just to strictly adhere to the public health measures that has been published. And this, they are not only doing it for themselves, but it's really the best thing to do, to be selfless and to protect the next person. While the young people can get infected and recover quickly without complications, they might expose vulnerable individuals within their family and surrounding and community who might develop severe illness and even complications that are leading to death. Hence, it's really a decision of life and death for the young people when they decide where to go, what to do, in what groups to gather to protect really the next person.
Very much so. Dr. Kandetu, any final remarks from you this morning, just briefly?
I think my colleague really has summed it up. Maybe if I can appeal to those who may be isolating at home, because as we do know that Most of the infections will host either an asymptomatic response or mild response. So many of these cases will be isolating at home. There are a number of measures that you can implement when you are home isolating. So if you have mild symptoms, perhaps the mainstay is the symptomatic relief. So if you have a headache, you can use analgesics like Panado or paracetamol. The normal flu-like symptoms is very receptive to things like vitamin C, zinc, and immune boosters. And I think equally what is important is there are a lot of lifestyle things that you can implement to boost your immunity. So things like getting enough rest, at least 8 hours of sleep a day, making sure you eat a well balanced diet. And then also making sure that you receive the necessary psychosocial support to protect your mental health. That's of course in addition to doing away with bad lifestyle habits like smoking and excessive alcohol use. And again, if I can reiterate the importance of adhering to the public health measures, because at the end of the day, this is really the weapon we have to safeguard against the spread of the virus.
Very much so. Dr. Kandetu, Ms. Shapala, thank you so much for joining us this morning. Thank you for sharing this very important information. Keep up the good work. Namibia appreciates you. Namibia is proud of you. Thank you for being here this morning.